Yeah, my name is Hani Ertemi. I'm a consultant urological surgeon. I work at Mid and South Essex NHS Trust, and I'm the site lead at Basildon Hospital. So my general practice in urology will include diagnostic and therapeutic. When it comes to the diagnostics, that will involve the common conditions in urology, like waterwork symptoms, blood in the urine, blood in the semen, swelling around the testes, painful testes, tight foreskin, um, and prostate-related problems like prostatitis, inflammation of the prostate, and and things involving um, um, kidney stones and prostate. That will be the general interest in urology I have. So my special interest is in prostate surgery and kidney stone surgery, especially the minimal invasive technique. So when it comes to the prostate surgery, I have special interest in laser prostate surgery. It's known as HOLAP surgery. And that actually has replaced the previously known case or previously known surgery as TURP, or people know it as TURP. It's and surgery involving cutting the prostate with laser to create a nice big channel to allow the urine to flow better. It has an excellent results and works very, very well in over 90% of the cases, I would say. However, it's slightly invasive procedure and might have some side effects, especially sexual side effect. And as a result, we also offer a minimal invasive technique called Visum surgery. And in this surgery, you treat the prostate with or you treat the prostate with hot steam. So it doesn't involve cutting or bleeding. It just you shrink the prostate using a hot steam, much smaller procedure, not as effective as the laser operation, but much less side effect and especially sexual side effect. And that's usually is very appealing for a young age group. So that's when it comes to prostate surgery. My other special interests will involve kidney stone and ureteric stone and bladder stone surgery. And I do various type of surgeries for that, mainly laser. And all these operations will be a minimal invasive day-stay operations where the patient will have the laser stoned, the stone lasered and be discharged in the same day. So these two areas are my main interests, and I have been doing that for the last 7, 8 years as a consultant, or almost 10 years now as a consultant. And I've done hundreds and hundreds of these operations with great results. I chose in urology since the very beginning of my career, even from medical school. Urology has the advantage of combining both medical and surgical aspects. So you see patients and you can always treat them with drugs and medication. And if that doesn't work, then you can take it to the next level and offer them surgery. Of course, there are conditions where surgery is the only option of management. But that combination of both medical and surgical skills is not always available in other specialties. And in urology, you got this beautiful combinations where you can use both your medical and surgical skills alike. That's one of the things that attracted me to urology. The other thing is there's a lot of technologies in urologies involving laser surgery, endoscopic surgery, minimal invasive surgery, ultrasound guided procedure. So it's a very, very versatile procedure. The fact that you can change someone who comes to you in a very unwell status into you can pretty much change them from one position to another, from situation to another, is the most rewarding. In urology, patients with, for example, renal colic or kidney stones, they come to ANU in severe pain, severely distressed. We've had many patients, for example, ladies who will tell you that they've given birth previously and this pain is nothing compared to it. It's much worse than giving birth, basically. So such a severe pain that he can manage, treat, and the patient will be discharged completely pain-free in a completely different situation to when they came in initially. That ability to change someone from being very unwell to being normal is the most rewarding part I find in my specialty. Obviously, kidney stone is just an example. There are other things that we see in urology: sepsis, severe infection. Again, the patient will come to the A&E very unwell, and after treatment, they're completely different. So your ability actually to move someone from or help someone to go through such a horrible or stressful time is, I find, the most rewarding. I think the most important thing that patients value about us as a clinician is our integrity and our honesty. Um, Obviously, there are always limitations. You can't treat everything. You can't cure everyone. You can help everyone, but there are certain limits to what can you offer on certain occasions. And if you're honest with the patient, if you communicate clearly with them, if you tell them exactly what situation is, how much you can treat, or how much you can offer them. That's pretty much the most important thing. And I think any clinician should have a very high standard when it comes to communication and to be very honest with his patient. Urology is a very dynamic. It does change all the time. You need to keep up to date. There are a lot of researches happens, a lot of procedures that have. I mean, since I become a consultant 10 years ago, many things have changed in urology. And that's considered a short space of time, if you think 10 years. But there are too many procedures that have been introduced since then. Many medications came to the market. A lot of practices have changed. Keeping up to date with all of that can be quite challenging. You need to be willing to learn, no matter where you are in your career. If you become a consultant, it doesn't mean the war doesn't end there. Basically, you need to keep up to date. There are a lot more of minimal invasive surgery that we're learning at the moment, and it's coming through, and patients are interested in that. Actually, some patients come to the clinic with printout of some research papers or some newspaper they've read about something, some new treatment, and they start to ask you, can you offer me this? Is this available here? So you need to keep up to date, basically, because it's a very dynamic, actually, specialty. If you look at urology 30 or 40 years ago, it's nothing compared to what it is now. I think one of the common things we like to say is that things look better on the textbook, or patients don't read textbook. And I mean, what I'm trying to say here is the fact that not every case will be typical, and you have to have an open mind and you have to think outside the box. So a lot of patients who comes with certain presentation is not exactly what you think for that particular condition. Patient can present in various ways for the very similar problem. So yeah, I would say probably that's what I tell my juniors. Things look better on the textbook. It's in the real life. Things can be very different. The human body can be very complex. So don't expect patients to present exactly the same way like the textbook tells you. I would say probably being knowledgeable, skillful, and honest. I think those are the three more important ones.